Hello, my name is Dr. Jin-Hoon Park. For the past 20 years, I worked as university professor studying balance and gait disorders caused by neurological impairment, as well as effective rehabilitation strategies to improve these difficulties. Especially, I have devoted significant attention to cerebellar ataxia, which is one of the more complex neurological conditions, focusing on both its symptoms and rehabilitation approaches. While working at the university, I collaborated closely with neurologists at my affiliated university hospital and researchers in neurophysiology. Through these collaborations, I gained extensive hands-on experience observing and working with individuals living with ataxia and developed practical and evidence-based knowledge about how rehabilitation can make a meaningful difference in their daily lives. In neurological disorders such as cerebellar ataxia, effective rehabilitation requires a comprehensive approach, including first, explicit motor rehabilitation training that actively engages higher brain function. The cerebellum plays a crucial role in the automatic regulation and fine-tuning of our movement, allowing us to walk, maintain posture, and keep balance without consciously thinking about each action. When this cerebellar function is impaired, as seen in individuals with cerebellar ataxia, walking becomes unstable and maintaining posture and overall balance becomes significantly more difficult. When cerebellar function is impaired, one of the most important priorities in rehabilitation is to actively engage the function of a cerebral cortex, and a primary method for doing so is through explicit motor rehabilitation training. The essence of this explicit rehabilitation approach is to leverage cerebral function in two key ways. Number one, by guiding patient consciously recognize the fundamental component of gait, such as controlled weight transfer between the legs, proper postural alignment, and stability during single limb support. And number two, by engaging in attention-focused, deliberate practice of these elements to progressively rebuild walking stability and balance control following cerebellar damage. The second key component of comprehensive rehabilitation strategy is reflexive movement enhancement training that utilizes brainstem function to restore automatic postural responses. To briefly explain reflexive movement enhancement training, its primary objective is to strengthen the body's immediate responses to sudden changes in balance and to improve the ability to prevent and cope with falls. And instead of depending on compromised cerebellar motor pathway, this training focuses on activating and strengthening the brainstem vestibular spinal reflex circuitry. Another essential element of comprehensive rehabilitation strategy is a transfer of learning training, which is designed to improve balance adaptability across different environments. Transfer of learning rehabilitation is a scientific approach designed to ensure that movement learned in the therapy room generalize effectively to real-world environment. When cerebellar function is impaired, individuals may be able to perform movement in a stable and predictable conditions, but may experience marked instability when environmental demand change or when faced with unexpected situations. Transfer of learning rehabilitation approach goes beyond the simple goal of walking well and instead focus on systematically training balance control and adaptability by incorporating varied and changing environmental conditions into rehabilitation. Overall, effective rehabilitation in cerebellar disorders requires a comprehensive and integrated rehabilitation approach that addresses multiple aspects of human motor control. Moreover, considering the genetic variability and the high heterogeneity of symptoms among the patient with cerebellar ataxia, it is essential to establish individualized rehabilitation programs and implement them through a structured and systematic training process. Let me share clinical examples of a patient with cerebellar ataxia who underwent this coordinated and comprehensive rehabilitation approach. Case 1. The first patient presented with a typical cerebellar ataxic gait characterized by severe difficulty maintaining balance while walking, resembling the gait pattern of a person who is intoxicated. This patient participated in explicit gait and balance-focused training protocol as described earlier 3 times per week for 12 weeks. As you can see in the video, gait variability was significantly reduced and both postural balance and gait stability improved substantially. Even while walking uphill on an inclined surface, the patient was able to maintain stable balance and gait. Furthermore, under faster walking speed conditions, trunk sway decreased considerably and a more consistent and stable gait pattern was observed. Case 2. The second patient was relatively stable during level ground ambulation. However, when asked to step over obstacles while walking, clear gait deficit appeared. As patient approached the obstacle, step length shortened, walking speed slowed down, and a cautious shuffling gait pattern emerged. In addition, the patient required a long time to negotiate the obstacle while trying to maintain balance and ultimately needed assistance from a staff to cross the obstacle. For this patient, we applied explicit postural balance training along with the transfer of learning rehabilitation designed to improve balance adaptability. After training, when stepping over obstacle of the same height used in the pre-test assessment, the patient no longer showed shortened steps or slowed gait while approaching the obstacle and was able to maintain stable balance throughout. Moreover, not only could the patient step safely over the original 5 cm obstacle, but the patient could also step over a 15 cm obstacle during the transfer test without delay or postural instability. This improvement was observed not only when the obstacle height was changed, but also when the obstacle width was adjusted, including stepping over double obstacles successfully. In addition, under a more demanding dual task condition that required stepping over obstacles while concurrently holding a tray steady with one hand, the patient was able to perform the task smoothly and safely. The mechanisms and effectiveness of these rehabilitation strategies and training methods have been published in internationally recognized peer-reviewed journals in the field of rehabilitation science. Balance impairment and gait disturbances associated with cerebellar disorders require a structured and stage-based approach tailored to the severity of symptoms and the individual's level of functional decline. If you are seeking a customized rehabilitation program or professional guidance to restore your balance and improve your gait, please feel free to contact us using the provided contact information. For more details, please refer to our webpage. Thank you.